one thing I noticed so dramatically was how much it helped Maxine, secondly how much it helped Sam, and then the 4 children were just absolutely full of glory that we had had that program called Hospice to come to our home and tend to their mother.
Hospice is so much more than what I had initially viewed it as. It's not only end-of-life care, but it's also chronic end-stage disease management care. There were patients that had end-stage illnesses that were never going to get better, but were being cared for at home, and their care was maximized by hospice.
So if I'm a person who is at the end of my life and I need care, I need some attention of some sort, why wouldn't I want hospice? Why wouldn't I want the best care in the right location with people around me who love me and need me?
My wife came down with cancer, so as was necessary, we would go to our oncologist and keep check every 3 months. There come that bad day when the oncologist said, "I'm sorry, the tests have proven that the cancer is spread throughout your body, so that your time is limited, and I would desperately like to have your permission to connect you with Hospice, a great organization that will help you through the balance of your life." Well, it's true that Hospice does everything that you've ever heard they would do for you, which is to tend to a patient that's in their dying process. But they go so much beyond that and do so much more. It was so obvious that they had committed their life to the very cause of helping those who are in the ending process of their life to do it as pain-free as possible and with all of the love that they could show.
It became apparent to me that hospice was much more than care of the terminally ill when I went on some home visits, at which point hospice became care of chronic disease management in diseases that we know we can't cure, but we can attempt to control or to palliate symptoms as best as possible. The hospice nurse can integrate the care plan at home, and they help actively manage patients to have better quality of life. And it changed my impression of the scope of hospice being much greater than what my initial impression was.
When people talk about hospice, I think they're really, the fear enters people's mind right away about death and about dying. And when I think of hospice, I think of people living. I think of people taking opportunity to say, "I love you," and it's to make sure that people die with dignity and with respect. And it's taking the medical model that we're so used to and kind of turning it up on its ear and to say, how can we help you to do what you need to do now? Whether that's spiritually or emotionally, if it's pain management and symptom management, we're the very best team in the very best location, at your home, in your nursing home, in your apartment, with your family as caregivers all around you. What more could you want?
It's just a great relief to all of us to have such loving and caring people that have committed their life to helping those of us that are experiencing the end of life.
And the hospice nursing care that's delivered at home helps those patients maintain a quality of life at home that I was unaware of.
And so it's so much more than what anybody ever thinks about. It is about people and about love and about managing your health care until you take your last breath. That's what hospice is.